I am Dr. R. Sekhar. I am a consultant vascular and endovascular surgeon with the Kokilaben Dhirubhai Ambani Hospital, Mumbai. Over the next couple of minutes, I will be discussing with you about a very relevant topic called PAD. PAD meaning Peripheral Arterial Disease. So what is PAD? PAD or peripheral arterial disease means clogging up of our arteries. Arteries are the blood vessels in our body that carry clean blood. These arteries, when they start getting clogged with cholesterol and other similar fatty materials, which we refer to technically as atherosclerosis, then the patient is stated to be suffering from peripheral arterial disease. Now, why is it relevant for a patient to know if he or she has peripheral arterial disease? Well, the reason is that if he or she is diagnosed with a peripheral arterial disease, it's not only the limb or the other body parts that suffer, but what is more relevant is that he or she is at extremely high risk of developing a heart attack or a stroke. Who are the patients who will be at risk of developing a peripheral arterial? So, anyone who is over the age of 50, anyone who is a present or a past smoker or uses tobacco in any form is at risk of developing a peripheral arterial disease 3 times more than the normal population. Anyone who is a diabetic, anyone who suffers from high blood pressure, high cholesterol, and anyone who has a past history of any vascular disease, a heart attack, an ischemic heart disease meaning chest pain, anyone who suffered a stroke in the past, all of these patients are at 3 times higher risk of suffering from a PAD or a peripheral arterial disease. So, what are the symptoms of peripheral arterial disease? Peripheral arterial disease most commonly affects the legs, not to say that it doesn't affect other organs. So, for instance, it can affect the hands as well, it can affect the intestines, it can affect the kidneys, and it can affect the carotid vessels, meaning the blood vessels that supply the brain. In the leg, typically a patient with peripheral arterial disease will suffer from cramps on walking short distances, which is reproducible. So, the patient will say that every time he walks a short distance, he gets this cramp like pain, and depending on which blood vessel of the leg is involved, the site or the place where the pain is will be clearly pointed out by the patient. So, how does one diagnose peripheral arterial disease? Of course, the history, the symptoms as I explained, and the most important sign that is unfortunately often overlooked is simply feeling the pulse of the patient. A good pulse that is now no longer felt in any extremity is strongly suspicious, especially when you have a background of smoking or diabetes, of the patient having a peripheral arterial disease. And of course, there are some diagnostic tools thereafter, one of which is the ankle brachial index, wherein the blood pressure of the leg and hand is compared. But more commonly what is employed is what we call an ultrasonography of the blood vessels, which is a non-invasive test, which is commonly called a color Doppler test, which can accurately tell us about any blockages in our arteries, which is diagnostic of a peripheral arterial disease. Of course, at a later stage, a CT scan and an MRI or an angiography may also be mandated. So, what are the treatment options for peripheral arterial disease? The good news is that if diagnosed timely, the majority of peripheral arterial disease can be managed conservatively, meaning with lifestyle changes like exercises and healthy diet, quitting tobacco in every form. And there are good medicines now, like besides aspirin and cholesterol lowering agents such as rivaroxaban, which has been a very new exciting addition to our armamentarium. And along with these drugs and the proper control of BP and sugars, one can treat most peripheral arterial disease. Unfortunately, about 15 to 20% of peripheral arterial disease patients will land up requiring some kind of procedure, and this would be either what we call an endovascular procedure, meaning treating, opening the arteries with balloons, wires, or even stents, or doing a bypass similar to what is done in the heart. A vascular surgeon will be someone who will be the right person to advise you on this, and the right person to give you an unbiased opinion about what are the options suitable for the patient if need be.